Hello and welcome to this Foster Care Institute online training webinar, Reactive Attachment Disorder. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I'm an author of several best-selling foster care and foster parenting books, international speaker and trainer, and I have been a foster parent myself to over 60 plus children who have come through my home and joined my family. Indeed, over the years, we've had several children placed in our home and come to live with us who have suffered from reactive attachment disorder, so I know full well what it looks like, how to best treat it, and how exhausting it can be for all involved. Our goal during this webinar is to increase your awareness of what reactive attachment disorder, otherwise commonly known as RAD, what it is and how it affects the youth that you work with and the youth that you care for. Indeed, along with not only bringing awareness of what reactive attachment disorder is to you, we're also going to help you gain an understanding of what it might look like in regard to signs and symptoms, and what might be some possible causes, and how to best address it. If you have worked with youth in foster care for some time, then it's very likely you have heard the term RAD, or you've heard the term reactive attachment disorder. But what is it? What is reactive attachment disorder? Well, we're going to look at three definitions from three separate organizations. First, the Cleveland Clinic. The Cleveland Clinic says this: reactive attachment disorder, RAD, is a condition where a child doesn't form healthy emotional bonds with their caretakers, parental figures, often because of emotional neglect or abuse at an early age. Children with RAD have trouble managing their emotions. They struggle to form meaningful connections with other people. Children with RAD rarely seek or show signs of comfort and may seem fearful of or anxious around their caretakers, even in situations where their caretakers are quite loving and caring. And we thank the Cleveland Clinic for this definition. Next, we look at the Mayo Clinic, what they have to say, and they say this: reactive attachment disorder is a rare but serious condition in which an infant or young child doesn't establish healthy attachments with parents or caregivers. Reactive attachment disorder may develop if the child's basic needs for comfort, affection, and nurturing aren't met, and loving, caring, stable attachments with others are not established. And we thank the Mayo Clinic for this definition. Finally, we look at a definition from Verywell Mind, and they say this: reactive attachment disorder, RAD, is a rare but serious condition in which an infant or young child does not form healthy and secure bonds with their primary caregivers. Children with this condition struggle to form relationships with others, rarely seek comfort from caregivers, and have trouble managing their emotions. And we thank Verywell Mind for this definition. But let's dive deeper into reactive attachment disorder. Reactive attachment disorder truly is a rare attachment disorder where children and youth, they are unable to form a healthy relationship, a healthy attachment, if you will, with a parent, with a parental figure, with a caregiver, perhaps with someone like you. Now, we've said it's rare. How rare is it? Well, a study in 2010 found that less than 0.04% of Danish children have RAD, or reactive attachment disorder. A study in the UK found that 1/4 of children in foster care there have RAD. It is estimated that children in foster care exhibit much higher rates of reactive attachment disorder due, in part, to multiple displacements. Now, multiple displacements is when a child has been displaced from a home several times. When a child in the foster care system goes from home to home to home, from foster parent to foster parent to foster parent, to residential setting to residential setting to residential setting, and from one caregiver to another. When they do this numerous times, it is known as multiple displacement. And we see here again that it is estimated that children who have experienced multiple displacement, well, they have a higher rate of reactive attachment disorder. Let's look at what one parent said about attachment. Attachment. A secure attachment is the ability to bond, to develop a secure and safe base, an unbreakable or perceivable inability to shatter the bond between primary parental caregivers and child, a quest for familiarity, an unspoken language and knowledge that a caregiver will be a permanent fixture. And we thank Asa Don Brown for this comment. So again, what is reactive attachment disorder? Well, again, it's known as RAD, and it is a condition where a child does not form emotional bonds, healthy relationships, attachments with their caregivers, with their parental figures. Again, perhaps a foster parent, perhaps a CASA worker, perhaps a teacher, perhaps a staff member who works at the home that you're working at, some sort of parental adult figure. And they're unable to form a healthy attachment with them, many times due to neglect, emotional neglect, or abuse during those early formative years between ages 0 to 5, those years that are so critical for a child developing in a healthy fashion. To be sure, children with reactive attachment disorder often have trouble managing their emotions. Perhaps you have worked with youth who have difficulty managing their emotions. It's perhaps a possibility that these youth experience reactive attachment disorder. These children, these youth who struggle with reactive attachment disorder often struggle to form a meaningful relationship, a meaningful connection with others. Youth with reactive attachment disorder rarely seek, or they rarely show signs of comfort. In addition, they may seem very, very fearful or anxious around their caretakers, people like you, other staff members, even in those situations where people just like you are very loving, are very nurturing, are very caring. Now, there are two forms of reactive attachment disorder. The first is inhibited RAD. Those teens with inhibited reactive attachment disorder are very, very difficult to comfort. When they're upset, when they're anxious, it's difficult to comfort them. In addition, those teens with inhibited RAD are often very detached emotionally and withdrawn. This teen is very hypervigilant, very aware of his surroundings and what is happening around him. Yet, those teens with inhibited reactive attachment disorder often do not respond or react to what's happening around them. Along with this, those teens with inhibited reactive attachment disorder may seem very aggressive to others who try to get close, or they may lash out in anger. Next, we have disinhibited reactive attachment disorder. Disinhibited RAD. Teens with disinhibited reactive attachment disorder might prefer a stranger over his parents, over his friends and family members, over caretakers, over people such as you or anybody else he might know. Indeed, those with disinhibited reactive attachment disorder may seek the attention, and they might seek comfort from anyone else, even a stranger. Those teens who have disinhibited reactive attachment disorder are very dependent upon others, and they might act younger than their age. And finally, those with disinhibited reactive attachment disorder often appear very anxious. They're filled with anxiety throughout much of the day. As we've seen here at the Foster Care Institute in several of our webinars and our books, there are so many myths and misconceptions associated with foster care and all things foster care, including the youth that you work with, many myths and misconceptions. And we dive into those in many of our webinars here and encourage you to watch that. In addition, there are many myths about reactive attachment disorder. Let's take a few moments to look at some of the myths and some of the truths surrounding reactive attachment disorder. To begin with, there is the myth that problems with attachment rarely occur, and these problems are not serious. Well, the truth is, although we've seen that reactive attachment disorder is not common as other childhood disorders for youth who are raised in a traditional family setting, it is strongly linked to children who have a history of trauma and can have a huge impact on the child's development. There is the myth that reactive attachment disorder can be treated with medication. Sadly, the truth is this: there is no medication for reactive attachment disorder. No medication specifically for RAD. Perhaps you're familiar with the myth that only children from foster care or orphanages get reactive attachment disorder. The truth is this: many children, many youth with reactive attachment disorder have experienced abuse and neglect, which is why it is associated with the foster care system, or with foster care adoption, or adoption from orphanages. Truth is, even children adopted at birth or biological children can also develop this disorder. There's the myth that all children in reactive attachment disorder need is love. The truth is, children with the reactive attachment disorder unconsciously fear attachment and are threatened or feel threatened by love. Forcing a relationship or forcing some sort of attachment upon a child before the child feels safe or has learned to give up control and let their parents parent them, well, this usually backfires and makes the problem worse. So when you are trying to provide a nurturing, caring relationship for youth who have reactive attachment disorder, it may backfire. It might make the problem worse. There is the myth that you just need to parent someone who has reactive attachment disorder in a specific or certain way. Well, the truth is there's no magic parenting style. There's no magic parenting style that will help youth who have reactive attachment disorder. Parenting is not the fault, and parenting is not the cure. There is the myth that reactive attachment disorder is incurable. Well, the truth is, reactive attachment disorder is very, very difficult to treat, but there have been success stories along the way, and there is hope. So as you care for and work with youth who have reactive attachment disorder, there is hope. Now, before we go any further, it's important to keep this in mind. When you care for and when you work with youth who have reactive attachment disorder, it can be very exhausting and it can be very frustrating. Not only necessarily for yourself, but for the youth that you're working with and everybody in the facility. Let's look at reactive attachment disorder and foster care. RAD, again, reactive attachment disorder, affects many children and youth in the foster care system or those who were adopted as older children. It is usually found in children who were, again, severely neglected, which prevents them from forming healthy, caring, nurturing, loving bonds with a caregiver before the age of 5. As you can imagine, the rate of attachment disorders is so much higher for those who have experienced abuse and neglect. And those are two primary reasons why youth are placed in foster care, because of abuse and neglect. Each time a child or youth is moved while in foster care, again known as multiple displacements, it makes it more difficult for the child to form a healthy attachment. So if you have youth in the home who have been through many homes, who have been through many families and facilities, well, again, it's going to be very difficult for that youth to form a healthy relationship or a healthy attachment. One study by the Europe PMC found that 38 to 40% of toddlers in foster care who were maltreated met the diagnostic criteria for reactive attachment disorder. This suggests that RAD is relatively rare in the general population, but it's also rather common for children who have had to enter foster care because of neglect or abuse. Nancy L. Thomas is someone who parented a child with RAD, and she said this: "When you win, the child wins, and when you lose, both lose." Well, we looked at what reactive attachment disorder is. Now let's look at some of the signs, some of these symptoms. Those youth who have reactive attachment disorder, they might avoid eye contact. They may avoid any sort of physical touch. If you place a hand upon their shoulder, they may shrug it away. If you try to look them in the eye, they may look away. Some other signs include behavior problems, argumentative. If a youth is always arguing, or defiant, or a combination of all three, it's a sign that perhaps reactive attachment disorder is there within that youth. Those youth who experience or express fear or anger by throwing temper tantrums or frequently show that they are unhappy or sad is a possible sign of reactive attachment disorder. Teens who fail to seek support or assistance or fail to reach out when picked up might be a sign that they have reactive attachment disorder. Those youth who have a failure to smile, for some reason they simply will not smile, or they have little interest in playing interactive games with others their age, could be a sign that they have reactive attachment disorder. When distressed or upset, these youth might not seek comfort or show no response when comfort is shown towards that youth. Youth who show no positive emotions like comfort, love, or joy when interacting with you, other members of the staff, other residents in the home, could be a sign that there is reactive attachment disorder. Those youth who are sad and listless, is a possibility that reactive attachment disorder is a concern. Other signs include trying to find things in their environment that they can control, which makes them likely to break the rules. As we've seen here at the Foster Care Institute, youth in foster care often experience a feeling of helplessness. They feel that they have no control over the situation, over being placed in a home, over being moved yet again. So when a youth who has reactive attachment disorder, they may try to find ways they can be in control, which again will likely lead to breaking some rules. Those youth who have unexplained withdrawal or fear or sadness or irritability, or they watch others closely but do not engage in social interaction themselves, well, that could be signs that these youth suffer from reactive attachment disorder. One parent said this: "I need you to see my behavior as a symptom of my brain dysfunction, not willful non-compliance." And this was a parent who had reactive attachment disorder and was trying to care for her own children. So how can we diagnose? How can we diagnose one with reactive attachment disorder? Well, children are only diagnosed with reactive attachment disorder between the ages of 9 months and 5 years. A doctor will make sure the child does not have autism before diagnosing RAD. Other disorders may have the same sort of symptoms, so they try to rule out other ones, including autism, before diagnosing reactive attachment disorder. To be diagnosed, the child must seem sad or fearful and does not respond when their caregivers try to make them feel better. And the child must have experienced some sort of serious abuse or neglect, or have had multiple changes in caregivers at a young age. And these diagnoses come to us from the Child Mind Institute. Let's dig deeper into this. An examination of when diagnosing reactive attachment disorder might include the following. Doctors might be looking for details about a pattern of behavior over a period of time. They might ask for direct observation of interaction between parents or the caregivers, perhaps such as yourself, and the child or youth. Many times there will be an evaluation of parenting and caregiver styles and abilities. Doctors might look for examples of the behavior of the youth or child in a variety of situations. Doctors will also ask for information about the interactions with parents or caregivers and others. And finally, when diagnosing reactive attachment disorder, there may be questions about the home and living situation since birth. Now, it's important for us to remember this. Youth who have reactive attachment disorder are doing the very, very best they can. It's important to remember these youth most likely have experienced abuse and neglect at an early age, and they do not know how to properly trust or form a healthy relationship or healthy attachment with somebody. So they are doing the best they can. So we've looked at some of the signs and some of the symptoms and diagnoses and causes of reactive attachment disorder. Now, how do we help those youth? Those youth that we're working with on a daily basis, who are angry, who are violent, who have behavior issues, who are argumentative, who are withdrawn. How do we help them? Well, to begin with, it's not about us. It's not about what we might have done. Do not take the behavior of the teen or youth you're working with on a personal level. When they are argumentative with you or defiant, or there are behavior issues, or they will not look you in the eye or shrug off a handshake, or when they are withdrawn, it has nothing to do with you. It has everything to do with their diagnosis, reactive attachment disorder. It's very difficult for these youth to process their emotions and to handle it accordingly. Safety is such a priority. The teen needs to feel safe in the residential home. This goes a long ways in helping youth who have reactive attachment disorder. They need to feel safe. They can be triggered by noises in the house, especially during nighttime or when it's dark. Or they may be triggered by other ways that you might not expect. So again, it is important that you remind him that he is safe at all times, that you ensure safety. It needs to be a consistent, constant reminder for him. Now, those youth with reactive attachment disorder, they need to have loving and consistent boundaries and limits set. And those boundaries must be in place. These boundaries may seem less threatening and less scary, and in fact more predictable. When the teen understands that there are loving and consistent boundaries, and there are loving and consistent limitations, well, then he has an understanding of what to predict. Therefore, he will most likely feel less threatened. So help him understand what's expected of him, what is acceptable, what is not acceptable in the house in regards to behavior and language, etc., and what consequences there will be for any misbehavior in regards to these expectations. One way you can help youth with reactive attachment disorder is try to understand his personal family history. Understand how his family and how he as a youth and as a child, how he was affected, what the abuse and neglect might have looked like, or what the trauma or traumatic experience he and his family might have experienced. When you have an understanding of this, you're more conscious of his behavior issues. Find services for him that are based upon his unique circumstances, that he has reactive attachment disorder. Once that's been established, find some services, professional counseling, professional therapy, etc. And we'll look at some other services for him throughout this webinar. Find some that are unique for him. And when you're speaking to him, keep in mind that sometimes he will act younger than his actual age. So have language appropriate conversations with him. It is critical that you're reasonable and realistic with your expectations for him as he experiences reactive attachment disorder. Understand what he's suffering from and have realistic expectations about his progress, about his attitude, about his behavior. Do not expect treatment and therapies to quickly fix or resolve all the issues. Now, we've talked about love here. Loving, caring environment. Do not expect that loving him will solve all of the problems. In fact, we've seen here that those youth who have reactive attachment disorder might feel threatened by that love and caring and nurturing. Many youth who have reactive attachment disorder will have issues of defiance and aggression and behavior and are argumentative. They might be yelling at you. Avoid yelling back at him. Avoid being regressive or aggressive towards him. It's important that how you respond to him is done so in a loving, caring, nurturing, calm fashion. Lower your voice. Lower the intensity and tone of your voice. Come down to his eye level. If he's sitting, sit down with him and use simple words when you're talking to him. Help him develop breathing techniques and relations skills. Help him to breathe deeply. Help him to learn how to establish a sense of being calm. Tell him it's okay to feel the way that she does. When she's upset, when she's angry, when she's divine, let her know it's okay to have those feelings. And give words to her emotions, such as, I see that you are upset. I can hear that you're angry. I feel that you are withdrawn. Give words to those emotions so they can better understand what they're feeling and experiencing. Youth with reactive attachment disorder might seek out conflict, might seek out arguments, might be aggressive, defiant. When that conflict has finished, after any sort of conflict or trauma from the teen, and after any sort of consequences have been put in place, because you have put in place earlier your expectations of him and any consequences that might be in place. After all this has been done, it's important that you reconnect with him. But wait until he is ready. Do not force that reconnection upon him. When he's ready, reconnect with him. It's a reminder that he's cared for, he's loved. And when you reconnect with him, again, when he is ready, it helps to build and maintain a sense of attachment, a sense of trust, which is what he needs. He needs to be able to have a sense of attachment and trust with you and other caregivers. The power of praise cannot be undermined. It is so important that you find ways and opportunities to praise him all day long. You find opportunities to encourage him all day long. And you'll see there in this slide there are many ways that you can praise him, many ways that you can encourage him. No doubt you have some of your own. When working with youth who have reactive attachment disorder, it's quite common and normal for you to become frustrated sometimes. So when frustration overcomes you, or if you do or say something that might be considered insensitive, it's important that you apologize to him. Take responsibility for your actions and your mistakes. Because when you do this, it's going to help him to trust you. It helps maintain trust, and it teaches him some lessons. He sees you apologizing for your actions. It's going to show him that he can do the same. It reminds him that he is cared for in a consistent fashion. Remember, you are his role model. Those words, I'm sorry, go a long ways in not only helping to calm down a situation and to rebuild that attachment and trust, but also, again, as being a role model. We've noted here that many youth with reactive attachment disorder act younger than their age, both emotionally and on a social level. You might have to treat him accordingly, both verbally and in nurturing. Meet him at his emotional age. Doctors have found that exercise goes a long ways in helping those with reactive attachment disorder. Exercise allows him to let go sometimes of those frustrations, those stresses, that anger, that anxiety that's within him. And that exercise indeed triggers endorphins within him. Endorphins which allows him to feel good, so to speak. Now, physical activity is especially good for youth with anger issues. And we've seen here that those youth with reactive attachment disorder often do have anger issues. So look for opportunities for him to engage in physical activities and sports, both at the home and the complex, the facility that you work at, and perhaps in public and in society, maybe on some type of recreational or school sporting events. Whether it's throwing a football or a frisbee around, going for a walk, playing basketball, whatever it may be, look again for opportunities to engage him in some sort of physical activities there at the house and residential home, and also perhaps at school or in other social functions. Diet also goes a long ways in helping youth with reactive attachment disorder, yet sadly many do not appreciate the importance of a healthy diet. A healthy diet goes a long ways in building optimal brain development. So try to build a diet that's full of grains and fruits, vegetables, and lean protein, and try to avoid sugar, sugary drinks and sodas, sugary snacks. Snacks can be nuts and fruits. Again, a healthy diet goes a long ways in helping to build optimal brain development. Sleep is also important in the development, especially when it comes to teenagers, for a variety of reasons. And we dive into these reasons in the training webinar, Sleep Anxieties and Youth in Foster Care, right here at the Foster Care Institute. I encourage you to take time to watch that webinar. Now, if the teen is tired all day long, it's going to be very, very difficult for him to focus later on in the evening. So make sure you maintain a sort of consistent sleep habit and schedule for not only him, but for all who live in the home. Now, as we know, it's so important. In fact, it's critical for youth to form a healthy relationship with at least one main caretaker or adult figure in their life. This is in order to help them develop both socially and emotionally. And some of the relationships you can help them build are with you and fellow staff members or caretakers, perhaps previous foster parents or caseworkers in the life. If the youth has a CASA, help them to form a healthy relationship with them. Or perhaps with mental health therapists, or perhaps juvenile judges, teachers, church members. There's many people that you can help this youth form a healthy relationship and attachment with. When he's angry, when he's upset, many times he's going to want someone to listen to him. So be there to listen to him, but do not do so in a critical fashion. Do not overreact to him. Listen to him in a nurturing and comforting fashion, but make sure that you nurture and comfort him in an appropriate manner. And if you're unsure what that looks like, ask your supervisor. In addition, he needs consistency. When he has a consistent structure in his day, each week, each month, it will help him to feel a sense of stability and safety. So provide structure and consistency with mealtime and playtime, with chores and homework, etc. At the same time, it's important to be flexible when needed. Flexible if a ball game coming up, or a special event, or a dance. There are many forms of therapy that you can use at the home for youth with reactive attachment disorder. These include play therapy, perhaps playing cards or sports, playing with others. Music, perhaps playing his favorite instrument or listening to music. Art therapy is an amazing way where he can express how he's feeling through art. Animal therapy, perhaps you have animals at the home where he can sit down and care for and pet, feed, etc. When he's petting that animal and he's feeding that animal and taking care of that animal, he might express how he's feeling to something that is living that does not react or respond in a negative fashion. In fact, animal therapy can be very, very nurturing. Other forms of treatment you can use include group therapy or group support and medication. Now, we said that there is no sort of medication that specifically addresses reactive attachment disorder, but there are those medications that can be used to treat behavioral concerns. So if you have questions, ask your doctor about any medications that can be used to treat these behavioral concerns. But it's important to keep this in mind. The real work and the real healing is done through various forms of therapy, not through medication. Medication helps to treat it, but the real work, the real healing is done through therapy. And as always, consult with a doctor and your supervisor before giving any medication. And of course, document the medication as well. Ask your supervisor for any documentation forms that might be used in regards to medication. And once again, when that teenager is lashing out and he's angry and he might be yelling at you, or he's withdrawn, or we're not looking you in the eye again, do not take his behavior personally. Keep in mind what he's gone through. It's most likely he suffered from abuse and neglect as a child, and he's having a difficult time now. Again, do not take his behavior personally. It has nothing to do with you. You are doing a great job. For much more, check out these training webinars here at the Foster Care Institute. They include Trauma-Informed Parenting Part 1 and 2, Anxiety Disorders, Anger Management, and Child Development Part 1 and Part 2. If you're looking for some words of encouragement as well as some tips, check out the book, The Little Book of Foster Care Wisdom. Daily tips for those of you who work with youth in foster care. And we have many best-selling books here at the Foster Care Institute. I'm sure there's one available for you right now. For much more, visit the Foster Care Institute at drjohndegarmofostercare.com for so much more on this topic. Follow me on Facebook at Dr. John DeGarmo Foster Care and at Twitter. And if you have questions about this webinar or anything else that I can help you with, please feel free to email me at drjohndegarmo@gmail.com. I want to thank you for watching this webinar. I want to thank you for taking time out of what I know is a very, very busy schedule. Very, very busy job. Taking time to learn more about reactive attachment disorder and learn more about how you can help teens who experience and suffer from RAD. Thank you for all that you do for caring for those in crisis. For the Foster Care Institute, I'm Dr. John DeGarmo.